Hello class and welcome to part 2. Let me get there first. Go through part 1 again. We don't want to do that. Hopefully we learned that part. Okay, here we are. We're turning to pages 43 through 47 in part 2. This is part 2 of lecture 5A. So, okay, here we go. Kentucky licensure law on health records. Okay. When a child is enrolled into a center, you have 30 days to actually get some of these. Some of these forms you have to have immediately. The immunization records, you actually have 30 days to have that on site. And there are different types of immunization forms, but the one that Kentucky licensure is looking for is on the Kentucky immunization form. Now, if a child is up to date, it's going to have the current date on there, and then it will also say this form or this immunization is good until this particular date. Now, a lot of times you have to understand that children come to you and they are in foster care or whatever, and parents have neglected to have their immunization records up to date. So you can't just go to the health department or to the doctor and get all those shots at one time. That's not the way that works. They have to be in a certain sequence with a certain amount of months in between. So you may have a 4-year-old that's just getting their 2-year-old shots. But licensure looks at that as that it's a process, and it goes by the date that is actually on the immunization record. Now, some parents do not believe in immunizations at all, and they have the right to believe that. And just because a parent says, I don't want my child immunized, doesn't mean that they can't come to daycare. So what will happen is they have a provisional certificate or an exemption certificate that the doctor fills out and they sign and blah, 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 that basically says, and it's a different color too, I believe it's green, and it basically says, I don't want my child immunized, but I do want them in daycare. So we've gone through the legal process for Kentucky licensure, and you just place that in their file and it's fine. Okay, so make sure that you know those things about the immunization records. And I would also encourage you to get to know when the table of when their shots are and when they're supposed to be at certain ages, so that you can kind of check through that. Now, the health department once a year will send the director a list of when they are going to either come out and check the immunization records for every child in the center, or they want to report back to them, and that's usually January through June. But the health department does do that. I think it's the Healthy Start nurse that's actually over that section, and but that doesn't exempt Kentucky licensure when they come in, the specialists when they come in to check the center. If they don't have all the immunizations up to date, then you are cited on that, because it is a required document that must be in that center. Okay, the next form that you have to have immediately, before a child can be left with you, is you have to have permission to call 911. We call this the in case of emergency form, and it basically, the parent gives permission for the 911 call to happen. And on that, the family physician has to be listed with the phone number and address of that child's physician. They also want to see what hospital that the parent prefers. But if the child is in a county that's rural and it has a hospital and the parent doesn't want to use that, they want to go to a bigger city, they will do that if the child is not in danger of dying. If it is in danger of dying, they will take it to the nearest hospital and then transport after the child is stable. All food allergies, environmental and food, must be written down by the parent. Now, a parent, this gets kind of strange here. A lot of times parents will come in and they'll say, when their child doesn't like milk, they'll say, my child is allergic to milk. So, well, by Kentucky licensure law, we have to serve milk, okay? We have to serve them a certain amount of milk a day. And especially if we're on the food program, then in order for us to keep our food program licensure, then we definitely have to, because they monitor all that. So, the licensure laws basically say you need a doctor's note stating that what the child's allergies are. Okay? So, when we're talking food, especially milk, it has to be documented, and the parent or the center has to provide whatever type of milk that replaces that. They can't say, well, they can drink Kool-Aid. Well, we can't even serve Kool-Aid in a licensed center. So those allergies have to be documented. They have to have a doctor's note attached to them. And we need procedures on how to handle that allergy. Do we use an EpiPen? Do we give Benadryl? What do we do when that allergy occurs? Okay, and what happens to them? Do their lips swell? I'm allergic to latex. So if somebody takes a glove that's not latex free and they start working on my mouth, my lips swell. My tongue starts to swell. I get red blotches all over me. I can't hardly breathe. So you have to know what the symptoms are for that allergy. Peanuts. Some kids are allergic to wheat. Some kids are allergic to eggs. It really just depends. Now, for confidential reasons, those allergies need to be hung on a wall, but we need a cover sheet over top of them so that not everybody can see them. But when staff come in and they're in the eating area, they can lift that piece of paper up and look to see who's got food allergies, who has environmental allergies. So anywhere that child is, pretty much in the classroom or in the cafeteria area or in the bathroom, I would put an allergy sheet up just so that staff have that. But again, watch the confidentiality. Make sure there's a cover sheet on the front. Now, starting at age 3, children have to have vision records, and those have to be done by ophthalmologists and put on the Kentucky Vision form. And it's a very simple process. They can go to the Walmart, to those ophthalmologists, and have their vision checked. And it's something that parents need to go ahead and start doing. They also need to start taking their children to the dentist. Some take their children to the dentist as early as 2, but 3 is the norm, pretty much the norm age. Now, here are some suggestions to have as far as paperwork. Kids to have a TB test, and the physician will make the call if this is appropriate or if this is not appropriate for this particular child. I would suggest, I know as a former director, I wanted to make sure that these children belong to this parent. So I required a birth certificate, and I required a copy of their Social Security card. But I was the only person that ever saw their birth certificate or their Social Security card as a director. Those were two things that I never allowed any other person to see besides me in the center because of ID theft. I'm sorry. That Social Security card has their number on it, and people can steal that and do lots of bad things with it. And we don't want that, and we certainly do not want to be accused of that. So that's very confidential information. Also, their physical exam when they go to definitely when they go to preschool, they have to have a physical exam. When they go into kindergarten, they have to have another physical exam. But a lot of centers are requiring them before they can actually enroll in their center to have a physician sign off on a physical exam, talking to the parent about their weight, their height, different things like that, so that the daycare knows that the child is physically healthy. And then also a dental exam. This is something extremely new for little bitty kids, especially under 3 and 4. But it's probably something that's proactive in helping the parent understand their role as a parent, number one, and number two, getting the child used to going to the dentist so that they're not always afraid of the actual dentist and its office. So remember that every child has the right to confidentiality. All records are to be kept confidential. That doesn't mean you can go out here and say, well, did you know that Johnny so-and-so did so-and-so to Miss Maria? No, because you've just broken that child's right to confidentiality, as well as mine. So in your observations, when you're monitoring children's health records, I'm not talking about your 20 hours of observation right now. I'm talking about you as a teacher getting ready to say good morning to 10 of your little 2-year-olds, and you're going to inspect them and do a daily observation on them. Your book calls this the daily health check, which is what I probably should refer to it as. When you conduct a daily health check for each child in your setting, your goal is to determine whether or not any child is sick and should not attend daycare that particular day. Now, I'm going to tell you a funny story on a peer of yours that I have taught in the last 4 or 5 years. I can't remember. But I had sent them out into the field to do their 20 hours of observation, and part of one of their hour was to do this health check on a child. Well, for some reason, it had on there, it was for an infant, while changing a child's diaper, did you notice anything? Now, what I was asking was, and I didn't make myself clear, I was asking, did you see bruises? Did you see a rash? Did you see anything like that? Now, what I didn't say was that I really didn't want you, as the observer, to go into somebody else's classroom, pick this little kid up, take it over there, and start undressing it right in the middle of this classroom. And that's what she did. And the teacher almost freaked completely out. Well, then the director got upset, and then they called Miss Maria. This person in your class took this little kid who was screaming and crying, and they had him laying down on the floor, undressing him. The child was screaming and hollering because they were scared, because they didn't even know your student. Did you really ask them to do this? And I was like, no. But they assumed that I wanted to know about their butt, the child's bottom, and so that the only way they could see it was to undress it. No, you don't touch children in your center that you go and observe. You may ask the teacher, may I watch you when you are changing a diaper? May I watch you when you're taking children to the potty? May I watch you when you're doing your daily health check? But as far as you putting hands on a child, no, no, no. So in these daily health checks, we are to inspect and take note of the appearance and behavior of individuals or the children. In those daily observations provides us with a useful baseline for determining what is typical behavior and the appearance for that child. So, for instance, if you have this little blonde-headed girl that's got really blue eyes, and she walks in, she looks pale on Tuesday, and she looks pale on Wednesday, and she looks pale on Thursday and Friday, but no other symptoms, nothing. Your baseline is that her appearance is that maybe she may be anemic, but that's not something that you can exempt her from the daycare for. Okay? Or a child is crying every morning after its mother. Does that mean that this is just a typical behavior that happens every once in a while with 2-year-olds? Or is it an abnormal behavior telling you that something's wrong? So sight is one of the most important senses used in your observation. What does this child look like? What have I seen in this child before? Is this an abnormal behavior? Daily health checks help teachers become familiar with each child's typical appearance and behavior so they can quickly recognize when changes develop. Now, this is important. I've seen it so many times where parents will send their children to us, and they're fine until about 2 or 3 o'clock in the afternoon. Why? Because they've had Tylenol in them, and it lasts that long. So when they get up from nap, Tylenol was worn off. You can usually recognize when those changes develop with your daily health checks. Parents should remain with the child until the daily health check is complete. Now, what if the child is sick? I've got a funny... Well, I already told you my funny story. I did it too fast. I'm sorry. My funny story was about the student that actually took the child's clothes off. But how do you know when to send this child home and when not to? Well, your book does a pretty good job about talking about responding to illness, starting on page 45, 46, and the top of 47. And on page 46, it actually talks about, symptoms that are serious enough to send a child home. And those children should not come back until the norm is 24-hour symptom-free without medication. But some daycares have gone to 36 hours. So it really just depends lost my train of thought there for a second. It really just depends on, um, you know, what's going on. I'm sitting here looking at this list. For instance, if a child is having diarrhea, they have one loose bowel movement, and you call it diarrhea. That's not diarrhea. Diarrhea is they have a loose bowel movement, and within 20 minutes of the first one, they have another one. That is diarrhea. Okay? So, think about that. Don't be fast to jump on the bandwagon. This child's sick. I can't have them in the center. You know, you need more evidence, and you need to document your evidence on a piece of paper. And then what we do at our centers, we actually have a sick form. It's 8 by 10, and it has, teacher writes the symptoms down, how long those symptoms have been there. And then it asks the parent, did you take this child to the doctor? Yes or no? If yes, then I need to know the medication they put this child on. So they write that all in. And how often is the medication taken? They write that in. And let's see. There was something else I wanted to say here. Beep, 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 beep. See, Miss Maria loses her train of thought too, so it's not. So just bear with me for a minute. Okay, so the form is actually sent home. The parent has to sign it. And, oh, I know what it was. And then we also tell the parent when they can come back if they are symptom-free. So we'll say, like, if we send a child home with diarrhea on Tuesday, we will say this child needs to be symptom-free, totally symptom-free, by at least Thursday. They can come back if they do not have symptoms on Wednesday. If they have symptoms on Wednesday, they can come back on Friday. I will tell you, the strict policy of 36 hours has truly decreased the number of other children in our center who have gotten sick with the flu this year. And not only has it protected the children, it's protected the staff as well. Another thing that we do at our center, which is not in regs, okay, this is just recommendations that I have, is when children get the flu shot, we do not allow them to come back in the center until after they've had the flu shot 24 hours. Now, some of you all will probably go, oh, you can't do that. Well, I will tell you from lots of experience that I have not gotten the flu. Until recently. And a parent came in and she said, oh, by the way, my daughter just got immunized or just got the flu shot, but don't tell anybody. And I said, well, they have to stay out for 24 hours. You know, we have expectant mothers. We have parents who are taking chemo. We have a grandmother that's taking chemo. We have a staff member that's taking chemo. They can't afford to be around somebody that's had the flu virus put in them. Well, the person held me that she did not know this, blah, blah, blah. And so I had to let the child stay. And guess who got the flu? Me. And it was not fun. And I wanted to go back to that grandmother and that was a foster grandmother and say to her, not only did you put me in jeopardy, but you put my parents at jeopardy because they're around me. And these pregnant women are around me. And so I just can't stress this enough, that you really need to do these health checks, and you need to be very strict on your health policies. It keeps everybody from being sick. And I'll tell you straight up right now, it's not fun having the flu. So your health observation checklist, you can, I'm going to put a couple on Blackboard for you so that you can look at them, but you can also Google some of these health checklists. You're going to have one that you're actually going to use for your observation. But look at some other checklists. Don't just look at mine, okay? And I want to point out that a health check should be a checklist. Everybody should go by the same checklist. Every child must be checked off on a checklist. And remember, oh my goodness, remember, you are not a doctor or a nurse. You are an observer of typical behavior and appearances. And when you make that statement to a parent and you say, I am an observer of typical behavior, and I am having such a difficult problem concentrating today. I've got my mind on something else. And I am treating every person the same that walks in my classroom. So I'm checking off on, do they have a fever? Do they have diarrhea? Do they have vomiting? Do they have mouth sores? Do they have a rash? Do they have, is their nose running? Or do I hear them breathe? All those kinds of things. Now, if a child's got asthma and they just come in out of the cold weather, obviously you're going to know that. So are these typical behaviors and appearances, okay? But you are not a doctor, you are not a nurse, therefore you can't say, well, your child's got strep throat. Well, you don't know that. You haven't been to medical school, you haven't gone through residencies, you don't have MD behind your name. So therefore, you don't make assumptions like that. You just be quiet when it comes to that kind of stuff, because you can get in trouble for that. So we're going to record. Make sure that you checklist or you have anecdotal notes. Anecdotal notes are notes that you say have a page on Johnny, and they're notes that contain information or a description of events that you have written down and dated yourself and signed. That's how we record what we're doing. Now again, this information is confidential. Information obtained from daily check sheets and teacher observations should be treated with the utmost confidentiality. And you need a book or a notebook in your classroom and label it confidential information. This information should not be left out for everybody to read and for everybody to discuss. For instance, what if you had a child, you were changing their diaper, and you saw bruises on them? Okay, you follow your procedures. You call social services. They come in and check the child. They obviously have been hit with something because they have bruises on them. And they look at all that. And then you post it where other parents can see that. That's not confidentiality. That's a true story. Sometimes people do that. They'll just, go around and blab, talk about it, laugh about it, think it's funny. It's not. It's called child abuse. So what are the benefits of doing all this? Well, the benefits is that you have early intervention. It provides a unique dimension in the identification and understanding of how a health problem may affect a child's development. It also recognizes, if recognized and treated, the less negative the impact will be on the child's ability to learn. Okay, remember we said those two are connected. Let's turn to page 45. What is a check? A health check. There you have in figure 12 an example of a health check. Parents should be involved. They should remain while the health check is there. They should be encouraged to ask questions and voice concerns about their child's behavior, their physical condition, their habit, or their adjustment. And they should be alerted to outbreaks of communicable illnesses within the center. Parents are your partners, and you have to treat them that way with the utmost respect. They will respect you back, I promise. In Kentucky, we have the K-CHIP program. K-CHIP program. It's Kentucky's Children's Health Insurance Plan. It provides health care to income-eligible children. But so does Head Start. So does we have free screening programs for children. We have Medicaid assistance. We have well child checks through the health department. So getting children healthy doesn't mean you have to pay a lot of money out on them. It just means we need to find the right sources in our we have to find the right sources in our community and bring those resources back into our families and let them know what's out there. That's part of our job too. So your book goes into, after we talk about all this illness, it goes into meeting the needs of children with chronic illnesses such as asthma, diabetes, cerebral palsy, cancer, HIV, AIDS, epilepsy, and herpes. Now, a parent does not have to disclose to you that a child has HIV or AIDS or cancer or cerebral palsy or whatever. You're probably going to figure some of this out on your own. However, kids with asthma, diabetes, cancer, epilepsy, you're going to have to probably give them their medicine at a certain time, and you can't slack on that. And how to deal with, for instance, asthma, those kinds of things. And you're going to have to follow what they tell you to do or what the doctor has stated to them to do. Special needs children. Oh, sorry. I'm jumping ahead. Early childhood teachers can make a difference in the life of a child because their health does matter. This is the end of lecture part 5A, part 2.